Hello, this is Dr. Grande. Welcome to my video on the discrimination model of counseling supervision. So I first want to get started by answering the question, what is supervision? Specifically, counseling supervision. Supervision is an intervention provided to an inexperienced member of the counseling field, for example, an intern, by an experienced member, for example, a licensed professional counselor. The supervision relationship is evaluative in nature and has a gatekeeper component. So what this means is the supervisor is going to continually evaluate the performance of the supervisee and, if necessary, prevent the supervisee from entering into the counseling field. The supervision relationship serves to improve a supervisee's counseling skills, and it encourages professional development. It also monitors the quality of the treatment the supervisee delivers to clients. Supervision is not intended to be short-term. It typically lasts somewhere between 6 months and 2 years, and it can go on for longer than that if necessary. It is also highly structured. A written agreement between a supervisee and a supervisor is typically required, and it involves the obligations and responsibilities that the supervisor and the supervisee have. So now let's take a look at the discrimination model as described by Bernard as it relates to counseling supervision. This model has 6 different components. The first 3 are the skill foci. Now, foci is simply the plural for focus. So the 3 skill foci include intervention, conceptualization, and personalization. And then there are 3 roles. The 3 roles are teacher, counselor, and consultant. So let's start with the skill foci. We'll start with the first focus, which is intervention. Intervention is related to what the supervisee is actually doing in the session, the supervisee actions, that the supervisor can directly or indirectly observe. Conceptualization is related to the supervisee's understanding of what's going on in the session, how well a supervisee identifies patterns, as well as how well they choose counseling interventions. Personalization is the use of personal style by the supervisee as that supervisee separates any personal issues or potential countertransference. After a supervisor selects the focus, they choose a role. As I mentioned, the 3 roles: teacher, counselor, and consultant. So let's start with the role of teacher. This role is guided by what the client and the supervisee need. Often involves direct advice about certain interventions and skills that the supervisee can deploy in session with a specific client. The next role is the role of counselor, and of course this should sound familiar. It's similar to the role that a counselor would normally play, but there is a significant difference. When a supervisor is acting as a counselor for a supervisee, they can only use the counseling skills to increase supervisee effectiveness in treating clients and to protect clients. It's restricted to just that area. When a counselor behaves as a counselor, they're going to use a broad range of counseling skills to treat clients. So there is a well-marked distinction, well-defined distinction between behaving as a counselor with a client and behaving as a counselor from the role of a supervisor. It's important to understand that distinction. And then there's the role of consultant. The role of consultant is similar to the role of teacher. It's typically only used with advanced supervisees. It involves more discussion. For example, when a supervisee is already well-versed in a particular treatment intervention, it could be a discussion about another version of that intervention. It could be a discussion around personal issues that a supervisee may have, particularly when they already have a good handle on what those personal issues may be. Consulting could also be offering alternative strategies to strategies that a supervisee is already successfully deploying in sessions with clients. So as you can see, when you combine the 3 skill foci with the 3 roles, you have 9 possible combinations for the role of for the action of the supervisor. I created this grid that represents the 9 combinations, the 3 skill foci multiplied by the 3 roles. And I did this to give concrete examples of how each combination may look in practice as a supervisor. So I'm going to start with the focus of intervention, and then look at intervention as it intersects with teacher, counselor, and consultant, and then look at conceptualization across the 3 roles, and then personalization across the 3 roles. So let's start with the intersection of intervention and teacher. And I'll give you an example of why a supervisor may decide to use this combination with a client. I designed this grid to demonstrate the 9 combinations, to give concrete examples for the 9 combinations of the skill foci and the roles. So I'm going to go through these by row. So I'm going to start with the focus of intervention, and then look at the roles, and then the focus of conceptualization as they intersect the 3 roles, and then personalization. So let's start with the intersection of intervention and teacher. And I'll provide a concrete example of why a supervisor might choose to use this combination with a supervisee. So with intervention and teacher, the example I have here is a supervisee is taught to use the cognitive behavioral therapy downward arrow technique. Right? Fairly straightforward. The supervisee doesn't understand this technique, and the supervisor is going to teach them. Then we move to intervention as it intersects with counselor. In this case, the supervisor notices the supervisee is treating a client a little differently, but directly related to a skill usage. So the supervisee is using a particular, let's say, cognitive behavioral skill a little differently with this client, and it could be because of a personal issue, but again, still tied to the skill. So the supervisor chooses intervention with counselor and helps the supervisee process why the skill usage with a specific client is a little different. Now moving to the intersection of the focus of intervention to the role of consultant. In this example, the supervisee already has a fairly good handle on cognitive behavioral therapy. They're using the technique successfully, and they want to learn a few new techniques. So this is just an enhancement of skill when the skill set is already fairly well developed. So moving down to conceptualization. So if you look at the intersection of conceptualization and teacher, The example here would be that, say, digital audio recordings, for example, are critiqued to help a supervisee identify cognitive distortions. Now, cognitive distortions are consistent errors in thinking. They're patterns, a lot like patterns. And you might remember that identifying patterns is part of the focus of conceptualization. And this direct critiquing is consistent with the teacher role. So moving on now to conceptualization as it intersects with counselor. Now in this example, say that a supervisee is providing counseling to a client, and let's say it's career counseling. They're giving the client some career advice. And the supervisor notices that the supervisee's behavior is very similar to that of the client. So there might be a personal issue. So say that the supervisee is fearful of accepting a promotion, and the client is fearful of accepting a promotion. So they kind of have the same issue occurring in their lives. So this is a good opportunity for the supervisor to move to the counselor role and use the conceptualization focus to help make the supervisee aware that the supervisee's behavior is similar to that of the client. Now moving to conceptualization and the intersection with consultant. So this again is used mostly, the consultant role is used mostly for advanced supervisees. So a supervisee has a good handle on several theoretical models and wants to discuss new theoretical models for case conceptualization with the supervisor. So this would be the appropriate combination to use. So now moving to the last row, which is personalization, the focus of personalization. In the teacher example, let's say that the supervisor notices that the supervisee is using a lot of direct advice, and the supervisor suspects that's because of a cultural reason. The supervisor could give the supervisee an article to read regarding the use of direct advice as it relates to the particular cultural characteristic or issue that the supervisor thinks is relevant in this particular supervision with the supervisee. Now, moving to personalization and counselor, say that a personal issue, a supervisor recognizes that a personal issue is affecting a supervisee's treatment of a client. So let's say that the client has a substance use problem, and the supervisee has a history that's been discussed with the supervisor that leads the supervisor to believe that the supervisee might not be past issues that deal with substance abuse or substance use. So they're going to encourage the supervisee to recognize this potential bias that they may have against a client that is actively using substances. And they're going to work through these issues with the supervisee only to the extent that it affects the client, and they're going to work to protect the client. It's going to stay restricted in treatment effectiveness and protection. And then the final example would be the intersection of personalization and the role of consultant. So again, in the role of consultant, we're going to assume oftentimes there's going to be an advanced supervisee that's being worked with. And say that a supervisee has worked with a lot of clients with substance use problems, anxiety problems, maybe some different symptoms of trauma, but they're not completely comfortable working with clients who are depressed. So this is a discussion, right? But it is of a personal nature. It means that it's a personal style issue. So the supervisor is going to discuss different ways that the supervisee may work through becoming more comfortable working with clients who have depressive symptoms. So this grid that has these 9 combinations is just supplied to give you an example, a concrete example, but as you can see, there's many different ways or many different reasons that a particular supervisor may choose to use one of these 9 combinations. So I want to talk for a moment about supervisor roles, right? Many supervisor roles have been suggested over the years. Lecturer, teacher, advisor, acting as a model for a supervisee, facilitator, providing support, counselor, consultant, evaluator, monitor, case reviewer, master therapist, and administrator. The discrimination model really only addresses the role of teacher, counselor, or the roles of teacher, counselor, and consultant. Although you can see some of the other roles are fairly similar, like advisor is similar, support provider could be similar, like advisor could be similar to teacher or consultant, support provider could be similar to counselor. But there have been many roles suggested, again, over the years. The discrimination model really just focuses on the 3. So it's important to recognize some of the characteristics of the discrimination model as it's applied. Foci and roles will change inside of a session and, of course, across sessions. So it has to do with the immediate application of supervisory skills. So the 9 combinations that I reviewed a couple slides ago, in any particular session, a supervisor may use all of them. That would be pretty unlikely, but certainly 1, 2, or 3 of those combinations could be used within one session, and certainly across many sessions. Eventually, a supervisor would likely get to all 9 of the different combinations, or certainly 7 or 8. The focus should be appropriate to what's going on in the moment. And what that means is that if there's a more important focus, that should be the area that is highlighted by the supervisor. So a less useful focus should not be selected over a more useful focus. And again, as I mentioned before, the interactions are geared toward immediate learning. Right? So the combinations are selected for immediate benefit. And notice that the roles of monitor and evaluator are not addressed in this model. These are important roles which need to be added to the discrimination model in order to ensure quality and comprehensive supervision. I want to thank you for watching my video. I hope that you found it helpful. As always, if you have any questions or concerns, feel free to contact me, and I'll be happy to assist you.